Good afternoon, everybody, and thank you for joining us today. Well, healthcare is more than a job, it is a calling. And right now, more than ever, we need extraordinary people to join our team here at Nebraska Medicine. There are job opportunities available in many areas, including the units where our teams care for COVID-19 patients. So today we're learning more about what positions are available and who would be a good team member and what it's actually like to work in these units caring for these patients. So Brandy Johansson and Michelle Collins have graciously agreed to join us today to tell us a little bit more about their experience and who would be a great addition to the team. So Brandy, Michelle, thank you so much for being here today.
Thank you so much.
You bet. Now, you both work in the 5 West unit, which might not mean anything to anyone who's not regularly in the hospital. Can you just explain a little bit about what your title is and what your position entails? And Brandy, we'll go ahead and start with you and then toss it over to Michelle.
Absolutely. Hi, everyone. My name is Brandy Johansson. I am the nursing manager for 5 West, which is a medical surgical telemetry COVID unit. What my job entails is I get to lead an awesome crew of nurses, patient care techs, office assistants, to taking care of our COVID patients that come into the hospital.
And Michelle, go ahead.
Yeah, I'm Michelle Collins. I am the NPDS specialist, which stands for Nursing Professional Development Specialist here for 5 West. Actually, before that, I was a staff nurse here on 5 West, so I've served many roles here while I've been on 5 West. And I am honestly a fancy term for their educator. So I help get them onboarded when they're a new hire. I'm kind of that first face they see, that orientation week for someone on the floor. And then I assign them their monthly education, which sure really doesn't sound very exciting, but I make sure our staff stays competent and really is knowledgeable on the cares that they're giving our patients.
Excellent. So we discussed the fact that 5 West is currently a COVID-19 unit, but tell me a little bit more about the patient population that you see there, Brandy.
Absolutely. So pretty much for our unit, we are the med-surg telemetry side of COVID. The 2 populations we don't take care of here are the ICU or the intensive care unit patients or the pediatric patients. So we take care of, with COVID, it doesn't choose, it chooses who it wants to take. So it can be a patient that comes in with a heart attack and they have COVID. It can be a patient that had a car accident and they had COVID, so they'll come to our unit. It can be somebody with diabetes and hypertension and they'll come to our unit with COVID. So it really is a wide variety of patients and populations that you will take care of. And that's the fun, I think the fun thing with this, it's for someone that just really wants a wide variety of patients that they'll care for. So you can, on your shift, you could have a 44-year-old and a 90-year-old and a 20-year-old and a 19-year-old. So you just never know. And that's the exciting thing, what you're gonna walk into on that shift. So just wide variety of patients. Yeah, Michelle, anything to add with that?
It's been so cool seeing our nurses being used to taking care of 2 specific populations. On our floor, it used to be cystic fibrosis and our bariatric patient population. So we kind of got set in our ways. We knew what we were doing, and now changing to a COVID unit, we've really had to bring back some of those things that we remembered from nursing school and really start to become a more well-rounded nurse. So it's been really cool to watch our nurses grow.
I think it's been really cool to see the teamwork and basically the camaraderie that builds up with the different units, especially as people who weren't treating, obviously they weren't treating COVID patients several months ago, but kind of that teamwork in that building. So what makes 5 West kind of unique and special?
So hands down, teamwork. And I know Brandy was gonna say it. Here at Nebraska Medicine, 5 West is known as the Wolf Pack. And that has stayed with us through COVID. We also are very lucky that we have a centralized nurses station. And so our nurses really get to know each other, not only from when they're here at work, and I shouldn't say just our nurses, our care techs, our office assistants, myself, Brandy, we all get to know each other. And we really are a wolf pack and we're a family. And we take care of each other throughout our shift.
I would just add to that too is, you know, like Michelle said, we've always been known as kind of the teamwork unit of the organization. And I've been so proud of that. But just the work our team has done with COVID has even exemplified that even more. If you think about having to go into these COVID rooms, you're in all of this PPE and, oh, now my patient needs a glass of water, or they need a Tylenol. Our team does, we have Volt phones, which is an iPhone with an app on it. And we do a group chat with our whole team. And if someone needs something in their room, they'll just chat, they'll send out a text and that says, I need ice water in 53. And the team is right there to get that for them. So our teamwork has came even more together. And I didn't even think that possibly could happen. And it really has. It's been fun to watch.
You've been talking about some of the different roles that are on the floor, and I think people obviously think about nurses, but you'd mentioned some other positions like patient care techs. What kind of people make up your team, and who are we looking for right now?
Yeah, I'm looking for anybody and everybody that wants to come and join us. So obviously nurses, we're definitely needed of the nursing role. The neat thing about our unit is, and me and Michelle both, we love new nurses. We both actually have our master's in nursing education. So we really love to work with new nurses and build and grow them. But not only new nurses, new patient care techs that have never even been a patient care tech before. We love to work with these people to make them great in their role. So I hire new nurses, I hire experienced nurses, I hire new care techs, and I hire experienced care techs. So whatever. I just want somebody that is willing to learn. Even I've been a nurse for 14 years, and what I've learned in the past 8 months with COVID is it's been amazing. I didn't think I could even continue to learn more, and I have. Just these patients are completely different compared to anything we've ever taken care of. And so the oxygen demands, just how the virus reacts to different people has been very interesting to learn. And so for new nurses that maybe don't really know what they want to do, this is a great opportunity to come in and like we talked about, you get to take care of so many different patient populations. So maybe you'll take care of a trauma patient and you're like, wow, I really like trauma. But that's what we do. We love bringing on new nurses, and then maybe they find out they really want to go to the ER or they want to go to the ICU. We love to build them into an awesome nurse. And then maybe after 2 years, you're ready to transfer into a different specialty. That's the awesome part about med-surg is you see so much that maybe that you'll learn that what you really love in that so much. So like I talked about patient care techs, I'm always looking for awesome care techs that are wanting to come in and just take great care of patients. And office assistants, I also support 2 office assistants. I don't have any openings in that role right now. So mostly nurses and patient care techs is what we're looking to bring on right now.
You mentioned new nurses. I think a lot of people are curious to know, how are new nurses doing right now in dealing with COVID?
Michelle, you want to take that one?
Yeah, actually, it's funny you say that. One of our new nurses, she was a care tech here before she transitioned to a nurse role. And as she phrased to me, Michelle, all I know is nursing during a pandemic. I know no different, and it has to get better, right? And I said, yeah. But I will tell you, these nurses are so thankful to be on 5 West. When they were told they're going to become a COVID unit, 3 days later, we were a COVID unit. And I will tell you, they did not shy away from the challenge. Because I will tell you, day number 1 on a Saturday, myself, Brandy was here, and we were there supporting those nurses, talking through things with them. And we were all a little scared and intimidated. But these nurses have grown so much. They've become such great advocates for their patients. Those patients, their loved ones aren't here sitting at their bedside like they typically would. And those nurses have really formed bonds with them and gotten to know them and really gone above and beyond. A couple months ago, we had one of our COVID patients was celebrating a birthday with us, and they took the time to want to know the things that he did for his birthday and what were special to him. And they wanted him to have some of those things. Maybe he's not with his family, but as we all said, you're with your COVID family right now. And he was very thankful for that. So these nurses are just trying to make the best out of maybe a not such a fun situation for them at work, as well as in their personal lives. And they are striving and becoming amazing leaders, and I'd love to watch them grow.
You mentioned the challenge of this time. We obviously want to paint a fair picture for people who might be considering this job in healthcare. So what are the biggest challenges that you're seeing right now? Brandy, if you want to start?
Yeah, absolutely. If I were to tell you this is rainbows and butterflies, I would be completely lying. So obviously I'm not going to paint that picture. COVID is hard. It's hard work. It takes a special person to come in here and be able to do what we do. The biggest challenge we have is obviously the PPE piece of it. So the personal protective equipment that our staff have to wear to take care of these COVID patients. So our staff have to wear obviously the N95 masks, a face shield, a gown, and gloves. So if you can imagine going into a room and maybe you have to spend an hour with that patient and all that PPE, it can get really hot. You sweat a lot. You can get exhausted. So it's very, very hard work. Thankfully, with our teamwork though, our staff, we work really hard to get them the breaks that they need. And our organization has done such a great job to providing the stuff that we need to care for these patients. I've never, ever, ever felt like we were short on PPE. So we always have adequate supplies of PPE. They also provide us with just simple water and Gatorade. So if you can imagine working in all that PPE, it's hot, like I talked about, it's hot, you sweat a lot, you're exhausted, and they provide a refrigerator with cold beverages of water and Gatorade to us so that the staff can just walk off and just know that they have that cold drink of water waiting for them. And the patients are sick, so that's another challenge, but also at the same time, it's a great learning opportunity for our staff as well. But these patients, they get sick and they get sick really, really fast. So the critical thinking that our nurses and even patient care techs have developed has been absolutely, like Michelle said, it's just been so fun to watch them develop those skills that we didn't even know that were there. And so yeah, I would say those are the biggest challenges we face.
I think right now we think about these jobs for people who are either really close to wrapping up nursing school or some kind of medical program, or maybe people who have some medical experience but have gotten away from it and are kind of feeling called to come back. And for those people, they might be thinking about ratios. So can you tell me a little bit about how many patients each staff member cares for?
Absolutely. So for nurses, with all the PPE demands that our staff have, we have 100% realized that our ratios need to be a little bit lower with these patients. So for both day shift and night shift nurses, your ratios would be anywhere from about 2 to 3, sometimes 4 patients, but we really try to stick right around that 3 mark of our patients. For patient care techs, once again, we did drop our ratios down a little bit. So we try to stick around that 6 to 8 patients per patient care tech for both days and nights. Now, that's a perfect world. So we always have to remember that's our perfect world where we want to be. Our reality right now is sometimes that might not be the shift that you come on, but we're working towards that. Most shifts are like that, but sometimes it just is that, like I said, that's our reality.
Michelle, I want to go back, kind of circle back to something that you hinted at before, and it's these relationships that our staff members are building with patients, especially because their families, in most cases, physically can't visit. So that has to be a huge piece of what these staff members are experiencing. Can you just tell me a little bit more about that?
Yeah, so I mean, if you think about this, your family's not at the bedside with you. They're not there when the physician rounds, or kind of learning those changes throughout the day. So that nurse is really serving as not only building a relationship with that patient, but building a relationship with that patient's family as well. They're helping get that patient's family the information that they need to check in on their loved one. And I've heard a lot of these family members say, once you put us at ease about that, we honestly felt so much more comfortable, and we knew that you were taking great care of our loved one there. And I think they can breathe a little bit of a sigh of relief, if there is one, when you know your loved one is here in the hospital and you can't come see them, but knowing they're getting that great care is huge. I'll tell you, when I was a nurse, and Brandy will say the same thing, we love to go in the room and sit down on the bed or the chair next to the patient and literally just chat with them, get to know them, because they're here, they're people, and I would want someone to do that for my loved one. We can't do that with COVID. One, with all our PPE, and we just can't sit down in a room and risk contaminating the back of our gowns by all means. So we find different ways to build relationships and build them kind of in short intervals. And I would say these nurses call in the room a lot to check on their patients. They're using technology in new ways, and Nebraska Medicine is helping us support that. So it's huge. And I hope we continue to use a lot of these after COVID is over, whenever that is.
We hear a lot about the stresses, and we've talked a lot about the stresses and how tough it is, and just kind of the sadness that is being seen in some of our COVID units. But I know that there's also some really rewarding moments, some hopeful moments. Brandy, can you just explain some of those? Because I think we would all like to hear about them.
Yeah, no, and it's so true. And I would even say sometimes the saddest moments, even sometimes are the most rewarding for our staff. And I'll share a couple of those. So our first ever patient death on 5 West was an individual that he had 0 family. He had no family. So we were his family. So our staff, they took turns sitting in his room, holding his hand up until the time he passed away. So we were there with him until the very end, and he was never alone through that whole experience. And it brings tears to my eyes because it was such an amazing thing to watch our staff do that for him. I knew they wouldn't have it any other way, but it was such an amazing experience. On the other end, we had, and they actually wrote an article about her in the Omaha World Herald. We had a lady that was 100 years old, and she was on our unit for, oh my gosh, almost over a month, I want to say. And we watched her walk out of here and go home. And, you know, we hear about all these horror stories about elderly individuals getting COVID, and it can affect them very severely. But she was one of the strongest women I've ever witnessed or watched. She beat COVID, and we are seeing that. And I know, like we talked about on the news, is we see a lot of the sad stories, but we are having some of those really awesome stories of people beating it, and we're able to send them home to their family.
I mean, I would, on top of that though, I would even say, like, some of our saddest moments, yes, are some of our best moments when you can, another example, we had a husband and wife both passing away, and we didn't want them to pass away alone. So we moved them into the same room together, and to be able to help facilitate that. And our nurses took great pride in being able to get them together, I think is huge. So it might have been a very sad moment, but it allowed a husband and wife and a family to know that their mom and dad were together.
And just so many ideas and ways of having to think differently right now, to do things differently right now. What type of individual are you looking for 5 West for any of the positions that we mentioned?
My number one thing I tell everybody is I just want someone to come in here that just wants to learn. You have to have that open mind and willing that things aren't always perfect, but I love bringing in individuals that they can see something and bring in new innovative ideas on how maybe we've been doing something, but they're like, well, why don't you do it this way? Oh my gosh, we never even thought of that. So let's bring in those innovative ideas. I just want someone that wants to come in and work hard and just give great patient care, because that's what our patients deserve ultimately at the end of the day. Someone that just wants to come in and I hate to say this, but have fun. We have fun with what we do. We all love our jobs, and our staff have smiles on their faces. You know, obviously there are very hard times, but at the same time, we do this because we love what we do, and we wouldn't come to work if we didn't enjoy our jobs. So want to come in here and just enjoy and love what you do every day. That's the person I want to come here.
I second that. Yeah, someone that wants a challenge too. It's not always easy coming into a group that really we're a team, we're a family. So sometimes a lot of people tell me that's intimidating, but I'll tell you, they're gonna open their arms and accept you and look forward to getting to know you. So we look for someone that also wants to be part of our odd, kooky 5 West family. Honestly, be a member of our team, because that's the only thing that's getting us through that right now, is our teamwork and the fact that we're all in this together.
The wolf pack, exactly. I'm like, who doesn't want to be in a wolf pack, right? I will say there's a lot of people watching who may know someone who's in healthcare, or the people that might be right for nursing jobs or patient care tech jobs. But there's a ton of people that are going to be watching this that are just regular people. And they want to know how they can support you guys as well. What's your message to them just as a frontline worker, because they are going out of their way to try and do things to let you know that they care?
I have a very simple one. If you know somebody in healthcare, go up to them and tell them thank you for what they're doing. That is such a powerful statement to us. And my neighbors last week came over, and I was outside loading my car, and they just came over, and they know I'm in healthcare, and they just said a simple thank you. And it brought me to tears, because I needed that day so much, because it was such a hard day that I had. And so very, very simple thank yous. I would say the second thing is I know we have, and Kayla, you probably can speak to this better than me, but I know we have some stuff here at Nebraska Medicine that you can donate certain things. And I know some people want to donate like money and things like that. And that helps to buy like snacks and water and Gatorade just for our frontline caregivers. And I can't tell you just that simple, and I spoke to this earlier, that simple of just knowing that they have a cold drink waiting for them after they've been in their N95 mask for 2 hours. I cannot tell you what that means to that staff member. And so just those simple things like that, I think goes so far.
Michelle?
I'll tell you, when we started all this pandemic and becoming a COVID unit, every day I'd come to work and there was a new message out in our circle drive saying, thank you for everything you're doing. I'm not asking for those big messages, but honestly, if you see a nurse out and about, tell them thank you. Tell them thank you for what they're doing. They might not be working directly in a COVID unit, but right now they're making sacrifices for the community and their family. So tell them thank you. And then I would honestly say enjoy your family, because we're spending lots of time away from ours. So enjoy your family and just be safe. Wash your hands, wear a mask. It sounds silly, but I will tell you there's so many times I go to the grocery store and I don't see someone wearing a mask, and it just makes me so sad, because we could all be doing this to help each other out and make this shorter for all of us, and we're not. So just those small things are huge and they mean a lot to all of us.
Well, I'm lucky because not everyone gets to say thank you face to face, but today I get to say thank you face to face. From those of us who work at the Med Center who aren't hands-on with the patients, we appreciate what you're doing, and when thank you isn't enough, and we appreciate the sacrifices, and not only in what you're doing to care for our patients, but also in being willing to take the role and speaking out. It means a lot. So we thank you for spreading the message, and the Wolf Pack sounds like a pretty amazing place to be. So thank you for your time. And for those of you who are watching, you might have heard Brandy mention the fund. That's through the University of Nebraska Foundation. We can go ahead and post that link in the comments for you, or if you message us, we can go ahead and respond to you with that. Just knowing that you did something to help provide a nurse with something that let her know someone cared about her or him means a lot. So nebraskamed.com/careers is the place to go if you're interested in hearing any of those openings. If you want to be part of the Wolf Pack. So Brandy, Michelle, thank you so much for your time today.
Thank you. We would love to have you guys. So please apply and come join our Wolf Pack.
Yeah, join the Wolf Pack.
And thanks to all of you for watching. We appreciate your support.